That's right. Let's do this, America. That's right. This is Countdown to AFP 2014 for Wednesday, October 1st, 2014. It is 9 p.m. Eastern Time. And here at Family Medicine Rocks World Headquarters, that's right, it's cooler here. It's 56 degrees. And of course, our topic tonight, which I've been talking about all week, is hashtag AFP 2014.
Whoop,
AFP
whoop.
Assembly, and maybe talk a little bit about the Congress of Delegates, afp.org/assembly. And of course, joining us today is our good friend, Dr. Jerry Tolbert. Jerry, how are you this evening, my friend?
Good, wonderful, Michael. How are you?
Oh, hey, just living the dream, baby.
Always.
Because people love us. People demand that we get back on the air. We've had a little bit of a break, and we'll explain that in a little bit. But, we're ready. We're ready, and it's October, and we're getting down to business. You know what I mean?
That we are. Lots of business to get down to. COD and the Scientific Assembly. Lots of good stuff.
So, but first, before we get to all that, big announcement right up at the top here of the show. I know you're just starting to get into this, but I just want to help promote and tease our next show. Our next show is going to be on Tuesday, October 7th at 9 p.m. Eastern Time, and we're going to have a big announcement, a huge announcement that is so much better than this show.
One might say it's a galactic-sized announcement.
So, if you're listening to the last show, we're working on our awkward pauses, and that was,
that was a perfect one.
Awkward pause. So, Tuesday, October 7, 2014, 9 p.m. Eastern, 6 p.m. Pacific. Huge announcement that I'm not going to talk about anymore, so you just have to think about it. So, updates. So, Jerry, you can go first. Do you have any updates for our vast worldwide intergalactic audience?
I do. As you mentioned earlier, we were on a little bit of a hiatus, and there was a reason for that. And I am trying to right now put into the screen share for my screen, if it will cooperate here, the reason for that, and that was these two little amazing bundles of joy right here. My wife and I welcomed. My wife and I welcomed Phoebe and Lydia into the world, and we've been spending a whole lot of time with them. They're a little over 3 weeks old, actually literally 3 weeks old today. Or no, that's not right. They're 4 weeks old today. They're a month old.
Wow. Breaking news. 1 month old.
So speaking of sleep deprivation and slow thought processes and concentration, there you go. I totally lost a week somewhere. But that is my family there. I've got some other pictures that I will intersperse throughout the show randomly, so that everybody can kind of see them.
And to let everybody know, so this will be the reason that you will not be joining us at hashtag AFP 2014 this year.
Correct. I am going to be here with my wife helping take care of those lovely ladies, as well as our 2-year-old. My daughter Ella will be 2 on the 22nd, so she's the reason why I wasn't at the Scientific Assembly 2 years ago. Although she did come with us to COD and Scientific Assembly last year in San Diego, so that was actually a really fun trip, and I'm really sad to not be in D.C. this year. I will be there by phone for a couple of different things. I've got the inside track. I'm not going to tell anybody about it, but I am on the steering committee for the FMPC. So the folks that that's right. Yeah, for the folks that put in grant applications, we voted on all of them. We've decided who gets money, and I will say this is the teaser, so make sure you're paying attention. There are some people that are getting money that may not have in the past because we made a decision to kind of split things up a little bit and help more programs. And that was a group decision, and I hope they don't get mad at me for talking about it, but it was a big deal.
So back up a little bit. So FMPC, explain that to the vast worldwide audience.
So basically, apparently there's this group in the American Academy of Family Physicians. Hey, watch that. You can't awkward pause while I'm talking. It doesn't work. So there's a group called the Foundation, which is a lot of different groups have a foundation. It's sort of a charitable trust that keeps the money that people donate and does a lot of good works with them. And some of that is to promote the specialty of family medicine. Some of that is to help for the care of our patients, for advocating for our specialty, all kinds of different things that the foundation does. But one of the things that they do is state chapters can come up with projects and then ask for funding matching or new funding or solo funding for these projects. And oftentimes they're projects that could potentially spread to other chapters or other parts of the specialty, and so it could serve more than just the chapter. And so this committee that I'm on decides, out of all the applications that the chapters put in, and states can put in more than one application if they want to, who gets that, that split pot of money. And so there's a certain amount that's set aside each year, and it changes from year to year based on a lot of different factors. But it's a great chance for some projects that would otherwise not get done, or projects that would otherwise be less effective, to get funding. So it's a really neat program, and it's something that our academy does. Well, the foundation of our academy.
Cool. All right. So just a quick update from my point of view here. So today, October 1st, they're just starting to sell tickets for TEDx Youngstown, Ohio, and which I am a speaker for, and so very excited about that. So if you're in the local area, come check me out, and all the great speaker lists there, and I'll be talking about it more. drmixvilla.com. So I have, 3 months to build a talk.
Nice.
So, I've been given 12 minutes. 12 minutes.
Is it going to be one of those cool talks where you have the little clicker and you walk around in a suit and with no tie and say things like, we've got to invigorate our emancipation so that we can obliviate our furunculation?
Actually, I'm going to try to go no slides. I'm going to try to go no slides.
Really? That's brave. That is incredibly brave.
Yeah, that plan will probably last about 20 minutes. Find some slides. So keep talking to Block there. So let's jump into this here, because I know people are here to talk about assembly. You know what I'm talking about. So afp.org/assembly. Let's jump into that. And it's October 21 through 25, and the aforementioned Washington, D.C. Now, before we get into this, I want to make this clear out there to people, okay? So, big disclaimer here, because people have been accusing me of other stuff. So, the views and opinions expressed on this show are not necessarily of the AFP, and the organization is not compensating me or Jerry, unfortunately.
Not at all.
For the coverage on this show. So, we don't have to put an ad and say, hey, this is brought to you by the AFP. This is just me and Jerry, very excited about the assembly. So all those people who are conspiracy out there, get out there.
And we also don't. The Sunshine Act doesn't cover this at all, so they're not going to see any. We're not going to show up on a website for Medicare or Medicaid or any of that stuff.
No, oh man,
that's one of my favorites right there.
Oh man, it's good stuff. So Jerry, so you had like a little photo shoot yesterday. Is that...
Well, that was actually a few days ago, but yeah, we took took a whole bunch of pictures because, well, honestly, they're cute, and I couldn't resist. But yeah, no, they were about 99% of the photo shoot was them crying up a storm, and 1% of it was some of the cutest pictures I think I've ever seen. So, it was fun.
Cool. So as we get started here, big shout out to our friends at AFP, actually, at AFP Assembly Twitter account. We know who that is. We won't say who it is, but we know who it is. Thanks for tweeting out our show, and please follow them on Twitter. They're at AFP Assembly. So the program, Jerry, the final, I believe is the final. Well, I guess the final program, I'm presuming, is available on the AFP website.
It is, so, and the app is also available too. So.
Yeah, what's your? Have you checked out the app yet?
Not recently, because I won't be there, so it just makes me sad.
Right. But I have checked it out. And friend me on the app, because I may do some really random stuff there that I might get kicked out of the Academy for. So download the app and friend me on the app, and I might get you some inside stuff.
That is not a euphemism. It is actually.
Yeah, it's not euphemism. And the cool thing this year, which now I'm allowed to talk about, because I've been embargoed, So there's going to be a cool little kind of meeting inside of the meeting. So there's going to be kind of a group of us called the Assembly Social Media Ambassadors. And it's me, and it's all the usual suspects. You know them. Jay
Hey,
Lee, Kim
hey!
Yu, and Jen Brawl.
Most
And
of the usual suspects.
who can and who are able to attend the meeting
Uh-huh, yeah, sure.
this year. And so we'll be there, and we'll be kind of like, we'll be tweeting, which we were going to do anyway. But hopefully we'll get some exclusive pictures and tweets.
Can I be there as a telepresence robot? Like, can I put my iPad on a stick with some wheels and roll it around and capture things that way?
We have a meeting tomorrow. Let me look at that.
Just make me a line item on the agenda. That's all I'm asking.
Okay. Man, I love how we do these rehearsals before the show. We should do that more. So the big thing here that I'm very excited that it's going to be happening, that we've been talking about kind of unofficially, kind of on the periphery, is this big title of this thing, Family Medicine for America's Health. And it's going to be a big announcement at this meeting. And officially on the AFP website, what they're saying is the goal of Family Medicine for America's Health, I think FMAH, I think we're going to be doing. No, I'm serious. I've seen some of the literature on that. I think that's how they're going to abbreviate it, if I'm not mistaken. Is to meet the needs of the American public by achieving the triple aim, better care, better outcomes, and lower costs. So that's going to be one of the themes that has been talked about already, but is really going to be emphasized in this initiative. The initiative includes 2 integrated elements: a communications program aimed at consumers, meaning patients, policymakers, payers, and the medical community, and a strategic plan that will focus on addressing key issues facing the specialty of family medicine. And it's going to be unveiled at the first Assembly General Session on October 22nd. So AFP members like Jerry and I have been receiving press releases and briefings on the AFP website, kind of the next step of the future of family medicine, and I've been reading some stuff and hearing some presentations about this, and they're in the process of building a website, fmahealth.org, fmahealth.org. I would guess that it's going to be unveiled at the opening on October 22nd. So Jerry, it's going to be very exciting. There's going to be an education piece. There's going to be a policy piece. It's kind of our organization is taking things to the next level to try to educate the public and policymakers and payers and everybody about what we think healthcare should be in America.
Sorry, I was just reading the bottom of the stuff I was supposed to read before we started. Okay, that's cool. Yeah, no, that sounds like a really neat opportunity, and it sounds like as family physicians, we're doing that stuff anyway, so it's a chance to really make that our focus. And what better way to do it than with social media and outreach and having people there that are going to be talking about this on the local stage, but broadcast on that national stage, which is what exactly the Scientific Assembly is about.
So that's going to be a big kind of a PR announcement, policy announcement. So that's going to be. I know that they've been working on this thing for weeks and months. So it's going to be. I know the traditional AFP press is going to be having a lot of press releases and all that kind of stuff. So I'll be curious to see what the membership think about that and how it gets unveiled to the general public. So be very exciting about that announcement. And other things that are going to be happening there, there's going to be these huge general sessions. And as I was looking through the schedule, Dr. Eric Topol is going to be there on Wednesday of that week, and going to be talking about his book and his talk. I mean, the creative destruction of medicine: how digital revolution would create better healthcare. And I've been seeing some recent press releases and talks given to him, and I think he's going to be releasing a book early next year.
Yeah.
And the title will be "The Patient Will See You Now," I think is the preliminary title about that. So that's going to be an interesting talk, and hopefully some of the social media ambassadors maybe will get to talk to him a little bit before his talk and get some exclusive tweets. That'll be very exciting on that.
I was trying to come up with a word that put exclusive and tweets together, but I just can't do it. So.
And also, so on Thursday, Anna Quindlen, Pulitzer Prize-winning journalist, she's going to be talking. Her title is "Healthcare in the Information Age: How Doctors, Nurses, and Consumers Can Make One Another Better." And on Friday, Dr. Dyke Drummond. The closing session will be burnout, happiness, and finding your path in the midst of change. So it's going to be a general session on each of those days, and I'm going to try to get to all of them because they're great topics, and also be out there trying to take notes and tweets and take pictures and try to broadcast some of that out to Jerry and everybody else who cannot be there in person. So, Jerry, the Academy always does a good job about getting some, the really good speakers, very relevant to the topics that are going on to our members these days. Don't you think?
Agreed. Yeah, I still remember. Now it was a Wonka conference, so it was when everything was joined together in Orlando several years back. But I'll never forget meeting Craig Ventnor and hearing him sing his DNA song to the tune of "Runaway." So yeah, they always do a good job of bringing in the big names and people that are pertinent and relevant to what we're doing right now. So.
And other stuff that's going on there, and I just saw this recently. That they've been really trying to get some attention on this. Is there's some individual tracks during assembly this year. There's going to be a track devoted to patient-centered medical home. There's going to be one specific to the direct primary care, and also to ICD-10. I was looking through some of those today, Jerry, and it's cool that the Academy is responsive to some of these hot topics. Especially ICD-10 and primary care, and of course PCMH. And in fact, I'm probably going to start to put those in my calendar on my app, so I don't forget to go to some of those. Jared, what do you think there?
I think there's wisdom in putting them in the calendar, but yeah, no, I think it's good that they're shifting focus and making sure that we're taking into account all of the things that we're going to be that the topics in medicine, they're responding a lot faster to the changes that are happening in the marketplace, which is something, that's a lot of, there is some buzzword stuff going on there, but it's stuff that's important, and for them to respond quickly to those. I started a direct primary care practice a couple of years ago, but in terms of scale, the Academy responding at that level is a big deal. So it is really good that they're responding to those things. The member interest groups, that's a huge push now, and that's one of the things that.
Jerry froze up. Hopefully Jerry can see that he froze up. Maybe he can start over there. I'm not sure. This has never really happened to us before, kids. That Jerry is all frozen up on the screen. Well, hopefully he can maybe work on it a little bit, and I can kind of continue. Shout out to our viewers out there, and because this is live internet TV, and I'm just kind of winging it now because Jerry is all frozen. Hopefully, he's figured out that he's frozen, and he's going to try to. He's hung up, so he'll hang up and call back. But so as he was saying, so we have these member interest groups, which are, these are opportunities for networking for specific groups. Like there's a direct primary care member interest group that's going to be meeting on Saturday. Rural health is going to be meeting on Thursday morning. and hospital medicine and independent and solo group practices and emergency medicine is going to be all meeting on Wednesday afternoon. And that's a fairly newer piece of the meeting, these member interest groups that the Academy is recognizing that these groups have unique type of interests. So Jerry, did you get into a black hole, or what happened there? Do you know?
I like Kirk's theory that I was shut down by the NSA. No, I think it's just, the sidekick was getting a little bit too much FaceTime, so now the Batman had to step in and make sure Robin knew his place. You're wearing blue today, I'm wearing red, so it's kind of Batman and Robin. It kind of fits. Anyway, no, I'm glad you talked about the member interest groups. That's what I was trying to say when everything froze up.
So yeah, and there's other networking opportunities. Jerry's been to some of these before. There's a new physicians happy hour on Wednesday afternoon. There is a global health/international networking meeting on Thursday afternoon. Member constituencies and member interest group reception on Thursday. So a lot of networking opportunities available there. And of course, the big assembly celebration is going to be on Friday night, and you're going to take in some of the national museums there in Washington, D.C., the National Air and Space Museum, the American History. Jerry, take over here. Let me see what's
going on. Mike was talking about the assembly celebration, and that's going to be... hey, you're not muted, by the way. Okay, there he is. Sorry. All right, emergency phone call there. So he was talking about the assembly celebration. That's going to be on Friday at 7 Eastern Time. National Air and Space Museum, National Museum of American History, as he said, National Museum of Natural History, the Newseum. So looks like the Smithsonian is going to be playing host to a lot of folks. I am really, really jealous of that, and I really wish that I could be there for that. There's a foundation dinner going on, as well as a 5K family run walk that's been planned. They try to do events like that, or they've tried in the last few years, and they've been quite successful at putting together some type of physical activity as well. So that's a really cool opportunity as well. Lots of different chances for people to come together, to talk to each other, to network, to really kind of see that you're not alone. There are a lot of times when we get out into practice after residency, and even if we're in a group, there may be things that we're interested in that don't cross over to other members of our local groups or other members of the faculty in our hospitals. And this is a chance to get together with a bunch of family doctors that are passionate about family medicine. So there's something for everybody. Doesn't matter what your interest group is, whether it's one of the interest groups that's listed in the program or an interest group that you just think up on the spot. There's a lot of people out there that really, really love family medicine and all of its facets.
So we're back on live TV. I just it's my fan club, and I told them,
nice,
don't call me during the show. So I mean, I don't know, Jerry. It's just it's tough being me sometimes.
That's how it is being the Batman.
Oh man, the AFP Foundation is having stuff on Thursday and Friday.
I already talked about that. I already talked about the run walk too.
Cool. So yeah, I mean it's just, so you went last year, didn't you, Jerry? You went to one of those networking events, right?
Yeah, actually, there are lots of great pictures floating around in the AAFP literature about from those things, because I have to find it, but there's a picture of me with my 2-year-old. At the time it was a 1-year-old. I was holding her while I was doing an announcement at one of the meetings, and so that got a lot of pictures because everybody loves babies. So, but yeah, there were a lot of good networking opportunities, especially for new physicians. That was the one that I was kind of partially in charge of helping with. I wasn't in charge of doing anything other than helping. But it was a good time. It was a good chance to really talk and meet. And it was in San Diego. It was actually in the convention center there, which is where they have Comic-Con every year. So that was kind of cool for the nerd in me.
Yes, and it's one of my it's on the bucket list to go to one of those, because I see some of the podcasts and some of those things, and you have a lot of good Comic-Con stories where you talk to people that I wish I could talk to. But we're not talking about that. But it's
actually that was
cool.
BlizzCon. That was a different con. That was in California, but in Anaheim, not in San Diego. So, but yeah, no, there's all kinds of stuff, lots of opportunities all over the place to network and to meet with, like I said, like-minded family physicians.
We should unofficially change this meeting to like Family Medicine Con or FM Con.
FM Con, that's awesome. FamCon.
FamCon. Hashtag FamCon. How about that?
Well, if we added I in the middle, if we went all the way to the I in family, then we could do Famicom, which would just be one letter off from Famicom, which was the original console. That was the Nintendo kind of the NES system. Yeah, nerdy reference. Nobody's gonna get it. Keep going. Awkward pause.
Oh, I'm sorry. Okay.
And we're done.
Okay, and I can't believe our good friend Kirk is he's yelling at us on Twitter.
I know. I keep getting it keeps going off in the background. I'm glad I have headphones in because.
What is that? What exactly does Dr. Tolbert watch on Google Glass when he's on the show? I don't want to know.
Well, I think let's see if we can get this to work. We've been playing with it. I don't know how well it's going to work. See, Kim Yu votes for FMCon. So you've heard it here first. All right, man. Here's what we're doing. I'm going to see if the screen share will work. All right, allow. Man, too many buttons. Okay, screen share. You all know what you're waiting on here. You have to
it's all very exciting.
Right.
Yeah, this is. We have a huge budget, and we're trying to. Oh, here we go.
Are you ready? Here we go. I gotta hit play at the same time here.
Guess what? I got a fever, and the only prescription is more cowbell.
That's right. The only prescription is more cowbell.
So did that work okay? I mean,
Oh yeah, no, it worked. Worked good. Yeah, we're going to try to incorporate more videos during our shows because people don't want to see us. They want to see entertaining stuff. So.
Oh man.
I don't know.
Entertaining, yeah, right.
Yeah.
Anyway.
So before we go on, I just want to talk about assembly. We'll talk about it, next week on our countdown to AFP 2014 show, Tuesday, October 7th at 9 p.m. We're going to talk about a lot of this stuff again, and we have our huge big announcement. We'll have a huge big announcement on Tuesday, October 7th.
Huge big. One might say ginormous.
Ginormous.
Yeah, it's actually in the dictionary. Look it up.
I might have to Google that. I don't know what Google is, but it is a really big announcement that we can't talk about.
We can't say a single word.
We can't say a single word about it. But before we go on, I do want to give a big shout out to next spring's meeting, which is going to be a huge thing. Huge, enormous.
It's going to be a huge deal. I promise. There's going to be a lot of good stuff. It's a good thing.
Wow. Let me Jerry take over.
Okay, so what he was referring to there was the National Conference of Constituency Leaders that is going to be a part of, and I'm lost the big fun name of it, the Spring Leadership Conference. That's the big broad name for it.
It is the AFP Leadership Conference for Current and Inspiring Leaders. We're still trying to get used to the terminology of this thing, but we're still excited about it. I believe it's April 30th to May 2nd, 2015, I believe are the dates. AFP.org/leader. And so there's two parts of that. So there's the annual Chapter Leader Forum and also the National Conference of Constituency Leaders. And so I've already been talking about some of the peeps out there on this, Jerry, and trying to get people out there to to rustle up the troops. You know, just trying to get new people to come to this. It's always fun. There's always new people coming to this spring meeting to come to learn about policy making, to come to network, to come to get upset, to get excited, to learn about leadership. And that's where all of us, continued our leadership development, starting you and I, with the resident student meeting and going up through this meeting. But next year is going to be it's a huge meeting because it's the 25th year. And what I'm trying to do is I'd like to try to get some of those, I wouldn't call them old leaders, but the veteran people, the people who have come through that and are doing awesome, great big, awesome things now, who are, national leaders in different organizations, in family medicine and out of family medicine. Hopefully, you can come back and have a little reunion party next May in Kansas City. I'm very excited about it, and I know Jerry's very excited about that. He's nothing. He's got nothing. He's got nothing. See, look at that. I don't know. Jerry. I don't know what he's doing. Did he mute himself? I'm not sure. I don't know. I don't know what's going on with Jerry. Jerry's frozen again. So he's so excited. He's so excited that that the NSA got him again. So I'm not done what's going on with that. Hopefully he'll figure it out and hang up and then come back to us again. So I don't know. It's just apparently it's a big problem. So I think he's calling back on the bat phone. So we'll see. Jerry, are you with us? Are you calling in on the satellite?
I think the uplink is this thing on? Is this thing on? Can you tell me, is this on? Oh wait, okay, all right. I am live once more. So what'd I miss?
We solved the problems of the world, and we'll see if people are still yelling at us on Twitter. I think they are.
They're talking about us. I don't think they're yelling.
They're talking about us, and we're getting props from our good friend Kim.
There you go.
About the cowbell reference.
I got a fever.
That's right. So what else?
Sorry. Kim sent me a message. She said since I was frozen, I should start singing Let It Go. Let it go, let it go. Not holding back anymore. I have a 2-year-old little girl. I know all the words.
That's right, yeah.
That's exactly why, yeah. Uh-huh.
And I don't have a little girl, but I still know the words. It's that, I don't know, does that make me, I'm not sure. I think we lost
Go ahead.
Well, we lost all our viewers, so I just...
what viewers? Come on, man.
We were up to 4 live viewers.
That's impressive.
Which is for us impressive. So.
Sorry.
Yeah.
So I know we're kind of getting toward the end here. I know one of the things that we did want to talk about, 2 things. We gotta mention some social media things that have happened since our last show. Since it's completely overdone and everybody's over it now, we need to talk about social media. The Apparently Kid, of course.
Yes, love the Apparently Kid.
But we need to move him to the end because he needs to be the sort of closer, because we need to close with something very powerful. So in the middle, Kim says she's still here, by the way. So in the middle, I think we should talk about something that is sweeping the nation, and by that I mean one person out of the several 100 million people in the country who happens to have a disease I'd like to call Ebola. And I'd like to play for you the theme song that I have been singing all day long to go with that here.
That's great, it starts with an earthquake, birds and snakes, an airplane. Lenny Bruce is not afraid. I have a hurricane, listen to yourself, churn world serves its own need.
So, as you know, we're all going to die. And I just want everybody to be ready for it.
Yeah, so like everybody else, well, all the cool people, and I'm including you there, Jerry.
Oh, thanks.
I heard about it on Twitter, and I was just there, let's see, I think it was, it was at the end of my office hours yesterday, and I was just, distracted from in my EMR, love it. And I said, I saw, the breaking news announcements that the first patient in the United States has been diagnosed with Ebola virus in Dallas, Texas. How did you hear about that, there, Jerry?
Same way. I actually heard about it on Twitter, or read about it on Twitter, overnight last night when I was feeding a baby at 2 o'clock in the morning. But it was still via Twitter that I heard it first.
And in general, what's been kind of your reaction to that, or what you're seeing out there on social media? I have my own kind of opinions, but I'll let you go first.
My reaction has been, look, there's a guy with Ebola. Imagine the surprise of the 30,000 other people that probably have it right now on the African subcontinent. My big concern, the concern of our specialty should be making sure that people know that there are way bigger concerns and way bigger problems that you should face, like wearing your seatbelt and getting your flu shot, than Ebola, mainly because the likelihood of you catching Ebola right now in the United States, numerically speaking, population-wise, contact with people that have it, travel numbers, if you really do the fuzzy math on that, it gets somewhere around the odds of you being struck by lightning while purchasing the winning lottery ticket for that night. And that's just kind of a ballpark on the math. But my fellow statisticians will kind of either ring me out or back me up there. But I sat down and just crunched a few numbers today on that, and that was kind of what I came up with. So it's not something that I think needs as much attention here as what it's getting. Definitely in Africa, Liberia, yeah, for sure, it needs a lot of attention. Here, the CDC has had a plan to deal with this since 1993. I think 20 years of planning is more than enough. If anyone's ever read The Hot Zone, that book came out when I was in high school. I remember the whole hubbub over Ebola then and Marburg virus. One of the things that I would tell people, too, is if you're worried about hemorrhagic fevers, hantavirus is endemic to the U.S., and if you live in the Southwest, you're way more likely to catch hantavirus from a mouse than you are from catching Ebola from the one guy who has Ebola in Texas. The end.
So I have 3 complaints that I want to put out there.
Only 3?
Well, 3 that I'll talk about just here with all of our friends and fans out there.
In mixed company.
Exactly right. So first is if you're worried about Ebola, get your flu shot. Get your flu shot. Get your flu shot. I was so mad about this. I wrote about this last month. Why an Ebola vaccine is not going to matter, and I don't have time to go through it here, but go to drmaxfellow.com and read that. Because people want an Ebola vaccine, but they don't want an Ebola vaccine. They're just want to be scared. Second, I just yesterday on Twitter and on Facebook and on places like Reddit, which I should not read, people just kept saying, I've been predicting this for a long time. Why, why are people so mad about it? We knew it was coming, but I knew it was going to happen. Okay, so yeah, we knew it was going to happen. I mean, what's the big deal about that? I mean, that's just me saying one of these days the big one's going to hit California. It's gonna be a big earthquake one of these days. And they said, well, Mike, how smart are we to bring the virus to the United States and put them in a hospital in Atlanta? Okay. Not sure if that's a good point. Well, what about they had this guy in Dallas and he was in a hospital, and then they sent him home with antibiotics. Well, I don't know that case. I mean, I did see the reports. I did read the reports. Man, maybe they should have isolated him. I don't know. People are like, well, we should, get the flight, information. We should know what the flight is, so we can, the press can contact those people. and really kind of really get things going. So there's been a lot of hysteria about this today. I've talked about it with a lot of my patients today. A lot of them are scared. A lot of them are irrational. There's a lot of people out there that are just the instigators, uh, or I mean, not just on the internet, but there's a lot of worried people. Some have good reasons, and some just have crazy reasons about why they're scared about this. And the third thing that I'm going to mention that I talked a little bit on Twitter and Facebook last night is that I mean, I'm a little disappointed, in the AFP, and I think there should be more information, out there on the home sites on this Ebola virus. I mean, you try to do a search out there on the familydoctor.org, and you don't get anything. I mean, it kind of really bothered me that this national organization is, I mean, I think they should, if anything else, put a page on there and say these are all the CDC links that you can put out there. The American Academy of Pediatrics, they have an Ebola page. Well, what is it? It is just a bunch of CDC.gov links. When I was a little bit disappointed, a little bit angry, that the AFP should be like having a page or acknowledging that Ebola exists on the website somewhere, and have some information for patients, for physicians, for providers, to try to get through this stuff. So that's probably one of the many reasons why I won't be elected to high office in AFP, because I'm lodging a complaint. But I think, I mean, I don't know. I think the organization needs to do a little bit better to be more responsive to things like this as far as Ebola. Another reason why that I'm not going to be anything in the organization, but I feel better, Jerry, that I've lodged this complaint, and that it's out there, and that I've talked about it already.
Well, good. I think. Tell me more about your mother. No, I'm joking. I don't
know. So apparently. So before we close up the show here, Jerry, is there something up with your internet connection tonight, or is it all your wires and stuff that are just getting crossed? Or what's going on out there?
So it's not my internet connection. I think it has to do with Chrome. I don't know. I think it's a software thing. I don't think it's a hardware thing, because I was playing around with that here this last drop, and all of my other devices and then all of my other internet connections on my iMac were fine. So, Google, Apple, they don't always talk to each other well or nicely, and so that's what I'm going to blame it on. However, it may just be my stupid fault for plugging in too many gadgets into this computer. Right now I have 6 things plugged in that may not be doing something. So, but yeah, I need to find something really quickly. So we're talking about.
So as Jerry is finding what he needs to find, and we're gonna have a big close to the end of the show tonight for people who are still watching us. That means you.
Or people that choose to watch us later.
So Tuesday, October 7th, 9 p.m. Eastern Time.
Be there or be square.
Be there or be square. And I'm going to plead to all of our Famicom friends. I'm using it now, Famicom.
I like it. It's going to catch on. We got it. I mean, this is a thing now.
That's right. It's a thing now. So in 2 years, everybody's going to be calling Famicom. So you be one of the cool kids and start talking about it now. So Tuesday, October 7th, 2014, 9 p.m. Eastern Time. Come back here, right here. We're going to have a huge announcement. It's going to be fun. It's going to be exciting. It's going to be entertaining. It's going to be informational. You're going to laugh. You're going to cry. You're going to make fun of us, but you can do that right now.
Or already are.
So Jerry, are you ready? I've been stretching.
vamping. Yes.
I've been vamping. I've
You've been
been
vamping, and I
uh,
apologize for not having everything completely ready.
yes.
I have half of it ready. That I was doing that as I was talking, but
So yeah, so I'm hoping that we will have some surprises next week. I've extended some invitations to some of the Famicom friends to see if their schedule, and see one if they're available, and two if they're interested in being on with me and Jerry. And I completely understand if they say no, but so
Maneuvering by McConnell.
oh, man, this is
scout meeting.
Mitch McConnell, who is just as
wow.
Mitch
This
McConnell,
is
in the end, is
What's
the
going
person
on?
who probably more than anyone else got this deal to the finish line.
I don't know. Is that an ad?
Oh, is that what yeah, sorry. That I didn't know that the audio
That's
was
an
coming
ad.
through. It's not showing up on my mixer, so I didn't know it was coming through.
Yeah.
If he hadn't been there.
This show is brought to you by MikeSavilla.com, DrMikeSavilla.com, and I approve this show. So for your entertainment.
Hold on. Okay. All right. I think I have it queued up now.
So Jerry, I set this up. This last little ditty that we have. That's going to be a big finish to the show.
Okay. A month ago, a little over a month ago, there was a young man who appeared on live television, and he had never been on live television before. And I'll just let him explain why. Here we go. The magic of live television here. Here we go.
Great! And apparently, I've never been on live television before, but apparently sometimes I don't watch the news because I'm a kid, and apparently Grandpa just gives me the remote after we watch the Powerball.
The Powerball. Tell me about the ride. What did you think about the ride?
Well, it was great because apparently you're spinning around, and apparently every time you get dizzy, that's all you do is get dizzy. Yeah. And I've never ever been on live television. I never ever be on live television.
Are you excited?
Yeah, and apparently I only went down the super slide. When I went down the one, I was scared half to death. I just freaked out.
What? I need his name. Hold on. Yep. Hold on. I'm just gonna ask him. What's his name? Noah. Noah. What's your last name?
Deck Ritter.
How do you spell his last name?
Ritter, R-I-T-T-E-R.
Okay. Where are you guys from? Wilkes-Barre. Oh.
Okay, so it was a little off there on the audio video, but that's the best we got right now. So
I have never been on live television ever, Jerry.
Apparently, that's a lie. You've been on live television before.
I have never been on live television. You can tell by tonight's show. I've never been on live television. And I could play that video all day. That is like, it's awesome.
Yeah. I gotta give props to my redheaded brother there. So he's not really my brother, but you know what I mean. My figurative brother, not my literal brother, because I have never been on live television before, except in the background once. So you know.
So apparently
this
is the end of tonight's show. Jerry, do you have any closing thoughts before we close things up?
Do you ever wonder why? Sorry, no, that's my worst Andy Rooney impression ever. But anyway, no, I just encourage people next week to check back with us. The thing that we're teasing here is, in all seriousness, something that we've worked fairly hard on, and something that we're too proud of right now, and we will surely get shot down over as time goes by. But we're still excited about it, and it's something that has been cooking for months, and we've been sitting on it, we've been teasing it, and we are just really Hey, Mike, can you do this for me?
No.
Open Gangnam Style. Kim called you Psy. That's why I said that. Anyway, but it's something that's near and dear to our hearts. It's something that we've been playing with and refining and changing, and just something that we're really excited about. And it takes a couple of pieces of stuff that's near and dear to us, not just the pop culture stuff, but the Academy stuff, and it puts it out there in a way that pays homage to all of the things that we love. So I just hope that people will tune in next week and kind of check that out, and I really think that it's going to be exciting. That's all I got to say.
Yes, it's definitely 5 months in the making that we've
longer
been.
Than that.
Well, yeah, probably even longer than that. But the planning stage and
right.
refining it and editing again, and something that we have created that we would like to share with all of you. It's not a phone or it's not a watch, but it is something that is.
We didn't even talk about that stuff. Holy cow, I forgot.
Well, we'll leave that for the next show. We need material for the next show. So yeah, please join us for our next show. We're very excited, and obviously it has to do with family medicine and leadership and some of our Famicom friends out there. So I hope you can all join us then. So Jerry, anything you want to promote other than your new kids who look very cute and awesome?
Yeah, not pimping anything right now except for them. They are pretty cute and awesome. And actually, since you brought them up, you've mentioned them. So now I have to. Oh man, sorry, I was trying to find pictures again. I have to put up some pictures. So give me just a second here. You can vamp for a few minutes while I'm doing that.
So October 7th, 9 p.m. Eastern time here on YouTube. And me and Jerry and maybe some other surprise people may show up. So is
that people who are surprised or people who are a surprise?
Either way, Jerry. Could be one of those.
It's a good thing.
Something like that. So obviously we'll be finishing up our countdown shows. AFP 2014, that is the official hashtag of the meeting, afp.org/assembly, and we go to Jerry.
This is Lydia after her first bath. She's a pretty cute little kid, so we had to get some pictures there. You talk for a minute here. Let me find some other good ones.
And So, follow me on Twitter, Dr. Mike Sevilla, drmikesevilla.com. I'll be talking about this more. AFP Assembly, follow them on Twitter, and hashtag AFP 2014.
Hashtag Famicom.
Hashtag Famicom.
FAMICON, and that's Phoebe, the grumpy resting face of Phoebe.
Wow.
And actually, just because I can, let's go back here. One more great picture from the other night's photo shoot. That's actually probably one of my favorites. If my stinking computer will let me find it here.
So what else? Didn't get to talk a lot about. We'll maybe talk about it on the next show. Congress of Delegates policymaking session of the week. So
yeah, I think
we'll talk about that on the next show there.
Yeah, we need to talk about that a lot. So this is the 2-year-old. She's got to get her moment in the sun too, because she's a cutie. So that's Ella.
Screen share?
Oh man, totally forgot. Hold on.
Hmm.
I took it down to change things and.
That's okay, man.
Okay, there we go. There she is.
Oh, there! Yay!
There you go. Okay.
All right. Cool.
Okay.
Cool.
I think we've hit the wall here though. So
That's
I'm
right.
good.
Going to close things up here. So thanks a lot, Jerry, as always.
Thanks, Mike.
And I, of course, with the shades, Dr. Mike Sevilla, drmikesevilla.com. Follow me on Twitter and also on Facebook and Instagram, all that good stuff. So
Google Plus.
We will Google Plus, and so we will see you next week for the next show where we are going to be the big reveal. It's going to be awesome. It's going to be great. It's going to be a good time. So, say bye, Jerry.
Bye, Jerry.